Good afternoon, everybody. Sherry, do you think we've got the majority of our group here
Yes.
today?
Yes, I do.
Okay, thank you. Usually when I stop hearing the beeps, I know that most everybody is on. So for those of you that didn't hear me earlier, my name is Mary Alexander, and I'm the past president of the North Texas AHRMM chapter. It's my pleasure to step in and support our president and leader, Tim, while he is unable to be a part of this meeting. So, you know, North Texas AHRMM is just like a family, just like a work team. If somebody is not able to be there, then we're going to get somebody to pinch hit for us. So it's my pleasure to be here with you today. And I am going to encourage those of you that have an interest in serving our chapter and want to join a committee to reach out to any of the board members or the names that you see on the agendas today, myself or Tim Martin or Sherry Fisher. You know, we want to keep this chapter a lively group and representative of the healthcare supply chain professionals in the Dallas-Fort Worth area. So please express your interest. Just shoot an email to the group or to someone on the group, or Taylor will give us our email address in a minute. So we encourage your participation on our committee. And towards that, I will introduce the board members and the committee chairs. And Timothy Martin is our president and CEO. The past president is myself, Mary Alexander. Our treasurer is Jeff Willett, and Melissa Long is our chapter secretary. We also have the various committees that you see on this slide. We have Lisa Marta, who takes care of our communications. Pamela Bryant is our philanthropy chair. Taylor Van Allen is our technology chair. Michelle Wood Martinez is our membership chair, and we have Sherry Fisher, who is our education chair and is responsible for putting together this presentation today, coordinating everything. So these are the people that you can reach out to, or you can reach out to, let's see, I'm trying to find the email, Taylor. North Texas AHRMM@gmail.com. So that's the email address for our chapter if you're interested in serving on one of the committees or want to find out something specific about the chapter. That is the email address for our group. So I hope everybody's enjoying the St. Patrick's Day and the spring-like weather that we've had this week. I hear that we're expecting rain tonight. Again, it's spring in Texas, so you just never know what you're going to get. But when we have someone as talented as Sherry Fisher doing our education for the chapter, we always know we're going to have a great presentation. So please allow me to introduce Sherry, and she will introduce our featured speaker for this meeting. Thank you, Sherry.
Thank you, Mary. Well, today we're going to have an update from the National AHRMM. We're going to learn what they're doing on the national level and also hear about the convention that's coming up in August. And Pam Bryant is going to do that. So I'm going to give a brief introduction and then I'll turn it over to you, Pam. So Pam is the Senior Vice President and Chief Supply Chain Officer for Parkland Health. She has over 20 years of supply chain experience and leads a team of over 200 people responsible for all aspects of supply chain: procurement, strategic sourcing, informatics, logistics, distribution, vendor management, and supplier diversity. Pam earned her Bachelor's of Science from Virginia Commonwealth and her master's, her MBA, from Everett University. She's on the advisory board of AHRMM and previously served as the president of the North Dallas chapter. She also served as a board chair for the Southwestern Medical TIF District Board, and she's a board member of the National Minority Supplier Development Council, the DFW chapter. She is the immediate past president and board member of the Women's Business Council Southwest. And now I'd like to introduce Pam Bryant.
Good afternoon. How is everybody doing? So I am super excited to be here with this group. I love North Texas AHRMM. And so being a member of the organization, as well as just being a newly elected advisory board member for the national organization, just allows us to be able to get information and show them what a great organization we have locally. So I'm excited to be here and I appreciate the opportunity. So we will move forward. Thank you so much, Sherry, for that very nice introduction. I appreciate it. Okay, so national update. So I wanted to give you a little bit of a background on the national organization. So the vision for the organization really is about advancing healthcare through supply chain excellence. And as all of my team knows about me, I always communicate that there's nothing that happens in the health system that my team does not drive. And so that we are an important piece of the organization and we support all aspects of the organization. So it's important for us to advance the supply chain and to make sure that we're able to support the varying needs of our organizations. The mission AHRMM strives to advance healthcare through supply chain excellence by providing education, leadership, and advocacy to professionals in healthcare and related organizations that are accountable for the community and committed to health improvement. So it's a big, it's a big statement, but it speaks volumes to the communities that we serve because healthcare is local. Healthcare is local within your community. You want to have professionals that understand. You want supply chain driven by professionals that understand how that advocacy is needed for those communities. And especially as I speak about Parkland, our communities are the disparate communities, the lack of resource communities, those communities that don't have as much access. And so we want to make sure that we're providing the same level of service that any other community gets. And so the health improvement and healthcare disparity that we see, we're trying to help eradicate that through supply chain and supporting our initiatives at Parkland. So the values of the organization are limited to I think, Sherry, the slide has not fully populated, but
okay.
I have it right here. So there you go. The value, so the vision, their values of vision, integrity, excellence, the same things, risk-taking, the same things that you would expect, right? Strategic partnering that you would expect within any supply chain organization. And so AHRMM really is, from a national standpoint, trying to improve and drive supply chain excellence throughout the entire continuum of the organization. So everything that it touches, everything that it does for the patient, because at the end of the day, the patient is what's at the end of the route. And so I always want my team to understand that the patient is who we're supporting. We do that in a lot of different ways, and we do that through a lot of different commitments through our team. But at the end of the day, the benefit goes to the patient. You can give me the next slide. Okay, so what's the purpose of the national organization? So really the purpose of the national organization is to be a conglomerate, right? It's a part of the AHA, so the American Hospital Association, which actually supports the country around healthcare. And so they have lobbyists that lobby for healthcare in Washington. They have committee members that sit on national committees that make decisions about healthcare and how healthcare is delivered. And so AHRMM is a subsidiary arm of, no pun intended, a subsidiary arm of the AHA. And so the national organization is supported by them, and we provide feedback to the AHA as they're talking to these leaders. What has been a good part of this for the national organization is that when we're in the midst of COVID, as you know, the country, right, our national stockpile, we learned that that was a mess. And so we've been engaged with the leaders around that stockpile and how we procure and why we're offshore and why we need to be onshore for some of these products that are made. All those conversations have been happening, and National ARM has been at the table with AHA. So the national organization is helping to support the supply chain, which is driven locally, but also to make sure that we have a national presence, that we have a seat at the table when decisions are made and as they're trying to drive change. So the big conversation now is about onshore, offshore, about is the stockpile that we have a good stockpile? How do we improve it? What challenges did we have during the pandemic that we can remove? What barriers were there, and how do we make it more efficient? So good conversation going around there. And your national organization represents all the chapters with the AHA to be able to support the supply chain across the country. Now, what's the purpose of your local rep? Which is me, by the way, and I'm so excited about that. So, and I got my assignment. Every board member has an assignment of who your chapters are. And so I received North Texas ARM, yay, and I'm a member, so that made it easy for them to decide on where they would put me. And I also have Gulf Coast. So I'm really excited about that. My job is to make sure that I'm communicating from the national level, those things that are going on, what we're working on, what things we need, things that you need assistance with, how viable are your local chapters, making sure you're turning in all your paperwork, to make sure that you're getting your designation as a chapter. And so those are the things I follow up on, and that I work with Tim, the president, to make sure that we have our things submitted and that he's aware of all the things that are going on nationally. So that is my job as your local rep. And then I take back any questions or concerns or things that we have questions about. So that's the purpose of me. The key events. So right now, the ARM annual meeting is the big thing. It is we're planning that meeting. I sit as vice chair on that annual conference education committee. So we are now looking at abstracts. If you can remember, there was a call for abstracts so that we would see about learning all the tracks that will be at the meeting. And so those abstracts are being reviewed. Tomorrow, we actually have a meeting to review our notes on all the abstracts. We actually had 103, which was awesome that we had that many abstracts submitted. And they're all different things. There's a category around the community. There's a category around senior management track. There's a category around improvement, around your healthcare supply chain improvement. There is a category around supply diversity. So there are a number of categories, and folks submitted abstracts to those categories to see what the agenda will end up being. So we select them. Now we can't have 103. So we select through those, the ones that we believe fit the organization, and also will be something that our attendees want to hear, need to hear, and can take away something and make an action. So we want to make sure that when you come to the conference, that it's an educational piece where you get something out of the workshops that you go to that you can take in turn and go back and apply to your teams to make your organization better. And these abstracts build that learning track for us. So that is what has been done. We'll get through those over the next few days, and then we'll start to build out the learning track. But the annual conference registration is open, so you're able to register and get ready to go. The Supply Chain Resource Council, I'm on that council as a representative for the chapters. Mainly, that is the resource council that is talking to the national stockpile folks at CMS. We have a CMS team. We have a human services group. So we have meetings and we talk with them about key things. So, for example, when we had the issue recently with oxygen. So oxygen was a problem getting in. It really was about COVID and about resources for our oxygen vendors to be able to have it delivered. So we had a call around that. The National Office of Human Services wanted to know how impactful is that? Is it hitting everybody in the country? all those different things. And so we are able to provide information and give suggestions around how we feel like they should help us and what help we feel like we need with that. So that's the Resource Council. So there are a myriad of organizations on the Resource Council from different places, large organizations, small, public, academic. So that council has a robust group on it that is speaking to that and what is happening within their group and within their community. So next slide, please. So my final slide I want to talk to you about is the annual conferences I've talked about. August 7th through the 10th, Anaheim, California. It is important for us to get together and network. So I would encourage you to make sure that you can try to get your teams there. We realize that there are several organizations that aren't traveling yet or have travel restrictions. And so we're hopeful by August that those things will be lifted and that you'll be able to travel. There are scholarships available. Go to the AHRMM website that's posted there, and there are scholarship opportunities available. Also, you can take your exam there. You can do one-on-one classes. You can do Supply Chain 101, Supply Chain 201. There's a whole myriad of pre-conference classes you can do. So this conference, because we haven't been together in a while, it's going to be a really great networking opportunity and an opportunity to see a lot of vendors who've been trying to show all of their great improvements after COVID, all their technology and those things. Will be at this meeting and you'll get the opportunity to see them all in one place versus trying to have multiple meetings at your site to look at these vendors. So we're excited about this conference, AHRMM 22, and that I would encourage you to send a few people that are able to go and bring back information to your organization to help you grow and to help improve. And I'm happy to take any questions.
Pam, I had a couple of questions. I know you explained why attending the conference. What can the members expect to learn at the conference?
Yeah, that's a great question. So I think it depends on your level. So it's what I love about the AHRMM National Conference. So you would say, oh, well, this person is a supervisor or this person is a manager. There are tracks for supervisor, for staff level, for management level, for VP level. There are tracks for that. And what you learn in those meetings depends on what your interest is. There are informatics meetings. There's an abstract, and so I have a little bit more knowledge because I've read a few of the abstracts, but there's an abstract that talks about how to work within your information system to deal with mismatches where you have things kicking out of your system. So those type of hands-on approaches are things that you can learn. You also have a strategy track where it allows you to think big picture and how does a bigger hospital do this versus a smaller hospital, and then how do you implement those in both cases? So you have a strategy track that allows you to do that. You also have a track of learning about new technology. So there's a technology track that shows you, you may be limited on your technology at your health system, but learning about the things that are out there and what pieces you can get, because sometimes you can't buy the entire suite of what let's say a Mayo Clinic or a Cleveland Clinic has because they're so technology driven, but you can get a piece of that to make your system better. And so then you get to find out through these tracks how to improve your operations, how to make your staff development. There's a section on staff development, which I love, and to make sure that your staff is growing and that they're getting the tools they need to be better at their job. And so there are such a myriad of tracks that you can learn, but you get out of the conference what you put in the conference. So you need to be ready to get engaged when you go to a workshop, ask questions, apply it to your own organization and ask those questions, and then just to make sure that you're able to have something to take away. They'll have templates in some of these workshops where you get a template that you can take and kind of do it at your own shop. They'll have white papers available. It is really an educational resource for supply chain that's all in one conference. And I think it's unique to a lot of other conferences.
Okay, it sounds really good. It sounds like you get a lot of best practices, a lot of strategies about how other other hospitals or healthcare systems do things. What about the networking? Can you talk about some things outside of the actual sessions?
Yeah, so there'll be several networking opportunities. Normally, so the way we set the conference up is there's usually the vendors have a section where you're going through and seeing your vendors and communicating there, so you're meeting new vendors. But there's also networking room. There are coffee break rooms, as we call them. There are networking events where you're just mingling and mixing and talking to different people. The speakers that have spoke at the different workshops attend these networking events. And so it gives you the ability to meet people different at different health systems or just doing different kinds of healthcare. It's like home health folks may be there. It's a whole barrage of people. So you want to make sure that you're tapping into that network because you could be at your location and remember that, oh, Intermountain Health said that they did such and such. I met so and so at Intermountain Health. And then you're able to call them and walk through your ideas because they're happy to take your phone call. So that's the piece of the network. And the networking is key to being able to keep abreast of what's going on, but also to give you something to lean on. I rely on that a lot. I call my colleagues a lot when something is, I got an idea and I'm like, hey, I'm trying to think through this. And I need people to punch holes in something that I'm trying to bring that hasn't been done yet. And that colleague group for me is really good at that. So absolutely, networking, you'll have plenty of opportunity to network. I ask that you take advantage of it.
Okay, so we have a question in the chat,
Mhm.
and it's from Joe, and he says, does North Texas ARM or National ARM provide scholarships this year to go to the conference?
So is Mary going to answer for North Texas?
So North Texas ARM has historically provided a scholarship. We have a board meeting in the morning, so I think that's on the agenda for tomorrow. So monitor your email for any information about a local scholarship. But I know that ARM does, and I'll let Pam address that.
Yeah, so the National ARM does as well. They have a scholarship opportunity. There's an application that you do for that, and that's located on that ARM website. Ideally, what is key is if your local chapter has the opportunity to do that, then putting your scholarship in to try to get into your local, to get it through your local chapter is more efficient. Just because when you think about the national chapter, it's just all the chapters can apply to that. Think about North Texas is really the membership. So yes, take advantage of those opportunities for scholarships.
And I know you mentioned, that while you're at the national conference, you can get certified. What's the importance of certification? What's the benefit of it? And can you just walk us through that?
So here's where I am with certification. I think certification is so important, and I think that it's helpful to folks as they try to move through their career. So I'm going to do a punt to my North Texas group because Mary, who walks through this certification well, I'm going to have her give you the benefits of that certification.
Okay.
So the CMRP exam, Certified Materials Resource Planning, I can't remember the acronym exactly, but that exam tests the individual over all aspects of supply chain. So from procurement to inventory management to contracting. And so once you pass that exam, you're able to put that designation behind your name, and that lets people know that, hey, I don't just work in this. I am a certified professional, and employers and recruiters look for that kind of information when they're looking for candidates for positions. And when you're in a field of candidates for advancement, those that have taken the time to study and learn and obtain that certification, just demonstrates, a level of professionalism that is recognized by our ARM chapter. So, and we as a chapter have talked about doing some classes, local classes for CMRP certification, and I know that is a standing item on our agenda. We've all been kind of thwarted, as this is not news to anybody with the COVID events, but I know that there's interest in having classes for the CMRP certification.
Thank you, Mary. So, and I do want to say the CMRP, and it is Certified Resource Materials Professional, but that certification is something that we hold out for supply chain. If you have that certification, we know that you've gone through the full gamuts. That does not replace your experience. So where I want to be careful around certification is it is great. We encourage it, but you're not, you can still move forward and grow and be all a part of AHRMM without having that certification. So nice to have. We encourage it. Gives you, I think, a leg up to be able to do it, but I don't want you to be discouraged if you don't have it.
Now, so we'll add on the certification that you have to renew it every 3 years. And when you renew it, you have to prove to AHRMM that you have obtained continuing education hours to keep your skill set sharp and remain certified for AHRMM. So,
correct. It's not a one and done.
A good place to get the continuing education hours would be the local chapter meetings, some regional meetings, and also the national conference, right?
Absolutely.
Yes. Yes.
Now, Pam, I see that you are, have been involved in AHRMM for quite a few years. Where did you start? I mean, as far as your involvement, and why would you encourage other people to actually get involved and serve on committees?
So I started with AHRMM. Date myself. At least 15 years ago. But for me, I was in a field where healthcare was new to me when I first I had done supply chain. I had been a general manager of a small organization where I ran their operations and ran their supply chain, but I hadn't been in healthcare supply chain. So when I got into healthcare supply chain, and I know we like to say, and in some instances it's true, that we're different. We are different in a lot of ways, but in a lot of ways we aren't. Supply chain 101 is supply chain 101. The basics of logistics and distribution, those things, the basics of those operations are pretty much the same tactics. You have to do them different when you're in different industries and you have different technology that helps you do those. But for me, the basis of supply chain is the basis of supply chain. So as I was learning, though, I wanted to make sure that there was an organization that I could tap into that would help me to grow, because a lot of our teams have grown through supply chain just because you started out as a tech and moved your way up. And that's a great way to grow. But that means you have to continue to have input that helps you to get better. So if you're learning from someone who's not growing or not getting that input, and you're learning that same way. And so I wanted to make sure that my team and I was able to be strategic to make sure that we can make impactful changes. And I also wanted to have a voice. I wanted to have a voice around things that impacted my organization, things that I felt like I wanted to improve, and things, how could a national organization help me do that? And that's how I got engaged. I joined as a general member. I then engaged my hospital to be a member, got all my staff there, and then started to do online classes, started to do some workshops, the regional thing. I joined locally as well and started going to meetings and networking and getting to know the sister hospitals that were around me at the time. And so I think that is how you grow. You can't be in a vacuum, because you only learn what is available to you at your facility. And when you've seen your facility, you've seen your facility. So you have to be able to look at other facilities, how they operate, talk to other people, and you'd be surprised at how much information you can provide based on your expertise to another colleague that makes their organization better. It's the whole shared network, the whole shared learning. And that's the piece that's important. And that's why you should be a part of AHRMM.
Okay, that's all great. I have one more question. I know Mary has a question too. So, you were talking about incorporating new ideas and bringing them back to your organization.
Yeah.
I know that's an art. you know, to have a new idea and to bring that to people. So how have you been able to do that?
So what happens for me is I get really great strategy ideas when I'm at the National Arm Conference. And so what I do is I look at the concept of what works for a Intermountain Health doesn't work for Parkland. But how does the outcome, the improvement that Intermountain Health received, how can I take a strategy that gets me to align in the improvement? So I take a strategy back, I bring that back. I want to have a conversation with my team. I want to talk about whether or not this is something that we can have a conversation about. Is this something we can do? I'll use my team over at the hospital. I will get a strategy in my head about something that I think we can do. I'll get that leadership team together there and I'll toss it out to them. And I'll say, this is where I'm trying to go. This is what I want to do. This is how this team did that. This is what I know will work based on my experience. Help me get there. And they'll tell you, I come up with a plan, and sometimes that plan for them is like, okay, that's gonna be way too much. We can't do this, this, and this because of this, this, and this. And what I always have to do is I step back and remind myself that I haven't been in the weeds. And when I say in the weeds, I mean working it, right? I haven't been the person cutting the POs. I haven't been the person receiving I haven't done that in a long time. Now, I always tell my team, I can do it. You're going to have to clean it up a little bit, but I can get a PO out and I can get a truck received. But you're going to have to clean it up when I'm done. But those things, I think, the way that I've been able to get strategy done, get new concepts in, is to work with my leaders, to give my concept, give my idea of where I'm trying to go, and let them give me feedback, and then how we can get there together.
Okay, Mary, I think you had a question.
Sure. Pam, I was going to ask you to compare the AHRMM conference to some of the GPO conferences. I know different GPOs have annual meetings, or
Right.
some of them are semi-annual. Can you compare AHRMM to those meetings?
Sure. So the difference in the AHRMM meeting and your GPO meeting is the AHRMM meeting is truly about advancing you. It is truly a personal mission about advancing the individual within the supply chain excellence to improve their talent to drive their organization forward. The GPO has great meetings about how you do business better with them, how they do business better with you, how your data works, things they've done for other organizations, best practices that they develop through that process. So the difference is, one is more geared to how do we be in the organization of a GPO, work better with you, provide more service to you, how do we improve that relationship? AHRMM is more about the individual and growing them as an individual and a supply chain professional.
No,
And
thank
getting
you.
back,
That's been my perception as well. So I want to encourage anybody else that has questions to either put it in the chat, or feel free to speak up and ask Pam about any of the aspects of our national organization.
you know, I had another question, Pam. You were talking about how the National AHRMM Conference is really about you, building you up. And I know, I guess I know definitely during the pandemic, some of the employees have experienced burnout. What have you learned from past conferences that, you know, that are able to refresh you or revive you? Are there sessions that talk about that, or that help the individual in that way?
We've been talking a lot this year about how do we have a session around not about employee morale and about engagement, because this last couple of years have really been hard, right? It's been a hard task. The supply chain has been on blast. And as I tell people, if you didn't know anything about supply chain before, you know supply chain now. And that comes as a double-edged sword, right? So everybody knows you now. So everybody's calling now, and everybody's expecting a delivery very similar to the heroics that were performed in the pandemic. But I think the best way around that is we want to talk about things that other organizations have done, and you want to share that knowledge. So that's why that networking is so important to us. Share what you've done, have those networking conversations, and they are looking to see, what can we do from a workshop or a ARM talk, as they call it, 15-minute ARM talk, that would, be committed to the mental health of our teams as they've been pushed to the limit a number of times during this pandemic. And so that those will be there as well. I do challenge the leaders, though. I challenge the leaders to make sure that you're taking the temperature of your team, that you're checking in to make sure your team's okay. They've been doing a lot. And so you just need to take the temperature of your team and make sure.
I want to also ask you, from your vantage point, being responsible for the North Texas chapter, North Texas region and the Gulf Coast region, what are some trends or what are some things that you've seen that you want to share with us?
So I think it's a great question, but I'm going to actually pause the question for you because I'm going to come back and tell you what that is at a later date. And that's because I started in January. So I'm still looking to see what the trend looks like. So I know North Texas, but Gulf Coast, we're still learning and we're still looking. But that's a great question. So I want to be able to come back and let you know what I see.
Okay, you're going to circle back with us. Okay, I'm going to hold you to that then.
Absolutely.
Do we have any more questions? Mary, can you think of anything? Any of our executive team want to ask Pam anything?
I haven't seen any in the chat, Sherry. I was wondering, though, the vendor fairs have always been a part of what I've really enjoyed about AHRMM, and I have identified some innovative products that I wasn't aware of until I went to AHRMM, to the AHRMM meeting. And so, what's the most innovative thing that you've come back from an AHRMM conference with, Pam?
That's a great question. Ooh. So I think I would say the innovation for me. Oh, that's a great question. I think, and I keep going back to my distribution because that's where it was. I think the greatest thing that I learned, we were trying to, when I was formerly at another organization, we were doing a merger. And so we were trying to understand what the distribution model would look like. And when I went to AHRMM and I was talking to a vendor about a new technology that allowed for the distribution model to sit in a standalone area. So you have your own warehouse, a standalone space, and that technology operated, and it was a little bit ahead of the time, right? But because people weren't really doing in healthcare, they weren't really doing pick to light and pick to voice and robotics and those things around the supply chain. But I saw an opportunity to look at how you could build you a separate, a self-contained distribution model that could support all of your okay, I lost y'all. Do y'all still see me?
Yes.
Yeah, we still hear you.
Okay.
You're
I was
still
like,
there.
okay. All right. So I said so that was what helped me when I had two systems to get together and both of them were running different types of warehouses. It allowed me the consolidation factor and also how to be able to set that up in an environment that allowed us to take distribution from about 14 hospitals to 30.
Mhm.
And it was a simple technology, which now is rolled up into a lot of different things. Texas has a model of it rolled up. N4 has a small model of it rolled up. That technology that's there that we're all trying to get to now is technology from a small vendor that started several years ago. So that was one of the best innovative things I've taken, and that innovation has moved forward because, as you know, most of those small tech companies have been bought up. And now are working within the larger space. So yeah, the Oracles and the Workdays and all those folks of the world are using a semblance of that technology that was built around healthcare. So yeah, that was the best innovative thing I had. It's a pricey concept anytime you have technology that's coming into healthcare.
Okay. All right. And we have a
Sherry,
question.
there's another question in the chat.
Yes. So the question is from Alicia, and she's asking, if you're new to supply chain, would you suggest we join the organization now, or would you say get some experience in the field and join later?
I would suggest you join now. You'll get, while you're getting your experience in the field, you'll be able to network. And as you're running through getting experience, you will run into issues. You will run into things you're like, oh, I wonder how I fix that, or I wonder what's a good way to do that. And this way you'll have a network of folks to be able to call and channel into. So I say join now.
So it sounds like, you know, the national convention and also becoming a member of AHRMM at the local level will give you experience. It will give you a network. It will give you opportunities to learn about new technologies and all of the different facets of supply chain, and then also get opportunities to lead, you know, to practice your leadership skills.
All right. And I would suggest that if you are not a member of AHRMM, that you start at your local chapter. That's the closest place where you can really get networking done, and there are people that you can tap into.
And we do have a membership chair, but I'm just going to put my email in the chat. And if you're interested in joining, just send me an email. So that
you can also reach out to northtexasarm@gmail.com too.
Right, and that's in the chat as well. Well, Pam, thank you. That was very informative. We look forward to continuing to have updates from you and to continue to have your involvement with our chapter. Mary, I'm going to turn it back over to you for closing.
Thank you guys so much. I appreciate the opportunity. And Mary, I'll probably just talk to, I'll probably talk to Sherry about making sure that there's a quarterly update for the organization.
That sounds great. Yes, thank you, Pam. Thanks, Sherry. So if we can just go to our wrap-up slide. The next meeting that we have is April the 21st. It's always the third Thursday of the month, and you will get a survey from the chapter. Please complete the survey. Your feedback is read and reviewed, and we appreciate getting your comments and your information and appreciate your participation in these meetings. So, pardon me, are there any other questions about the meeting? Very good. Awesome. Then I appreciate everybody's time, and thanks for joining us today. Bye.
Thank you.
Thank you. Bye-bye.
Thank you so much.